osteoarthritis. Osteoarthritis, although it is ending with the term arthritis, osteoarthritis, but that was a degenerative disease. Now we are going to talk another type of the arthritis, which is rheumatoid arthritis. In contrast to osteoarthritis, which is predominantly, which we talked about, that in the idiopathic, which is the most common group, is largely a disease of old age people. Today we are going to talk about rheumatoid arthritis, which is a disease of people between people in their second to third decades, usually women, and it is usually involvement of the symmetrical small joints, including hand and feet, and more common in hands. I again repeat, today we are going to talk about rheumatoid arthritis. This is another example of arthritis, but unlike osteoarthritis, this is a disease of young age, more common in females, usually involves symmetrical small joints, more common in hands as compared to feet, and it is an autoimmune disease. Okay? Like autoimmune diseases, what are the autoimmune diseases? In which the body's own, the immunity of one's own system start working against the body. ठीक है? Autoimmunity क्या होती है कि आपके अपने ही जो immune cells हैं, they start destroying the body of that person. And as all other autoimmune diseases are common in females, so that is why rheumatoid arthritis is also common in females. Again, rheumatoid arthritis is a disease of young age, usually second to third decades, common in females as any other immune-mediated disorder, and it involves the symmetrical small joints, especially it involves the small joints of hand. Okay, so this 569 definition is very important. As I said, that rheumatoid arthritis is not only about arthritis. It is an immune-mediated disease. It means it's going to have it's going to affect the joints as well as other systems of the body. During this lecture, I keep on comparing with the osteoarthritis, which is another common disorder, and we should give in detail. Okay? Because in the end of these two lectures, you should be able to differentiate between osteoarthritis and rheumatoid arthritis, the most common arthritis. Okay? As I said, osteoarthritis में basically joints affect है, and it was oligoarticular disease. Oligo का क्या मतलब होता है? मोनो का मतलब होता है एक, ऑलिगो का मतलब होता है फ्यू, और जो हम टर्म यूज करते हैं पॉली, इसका मतलब होता है मल्टीपल. आई अगेन रिपीट, मोनो आर्टिकुलर का क्या मतलब होता है? एक जॉइंट इफेक्ट हो रहा है, ऑलिगो फ्यू, एंड देन पॉली मींस मेनी. दीज आर द सिंपल मेडिकल टर्म्स. अब होता क्या है कि इन ऑस्टियोआर्थराइटिस इट इज यूजुअली ओलिगोआर्टिकुलर डिजीज, यानी 2-3 जॉइंट होंगे, एक नी में दर्द हो रहा होगा, हिप में हो रहा होगा, एक हाथ में हो रहा होगा. बट दिस इज एज कंपेयर टू दैट रूमेटॉइड आर्थराइटिस यूजुअली इन्वॉल्व द सिमेट्रिकल जॉइंट, यानी दोनों हाथ के जॉइंट होंगे, दोनों नीज होंगे. और व्हाई इज इट लाइक दिस? बिकॉज इट इज अ सिस्टमिक डिजीज, because it is an immune mediated disease. It is not only the problem with something in the joint, as it was the defective repair in osteoarthritis. Okay, so along with the joints in the rheumatoid arthritis, other systems of the body are also affected. ठीक है, other systems में कौन से affected होते हैं? Most commonly it is skin, but it could be heart, it could be lungs, etc. So what it is a chronic systemic inflammatory disorder that may affect many tissues and organs. Along with the joint, it can affect skin, blood vessels, heart, lung, and muscles, but principally it attacks the joints, producing a non-suppurative proliferation and inflammatory synovitis. Non-suppurative का मतलब है कि it has nothing to do infection. In the joint there is a lot of inflammation, but this is non-suppurative. It means it's non-infective. That often progress to destruction of the articular cartilage एंड एनकाइलोसिस ऑफ द जॉइंट। एक टर्म बार बार यूज होगी एनकाइलोसिस, इसमें जो एक रूमेटॉइड आर्थराइटिस की बहुत कैरेक्टरिस्टिक है, दो मॉर्फोलॉजिकल फीचर्स हैं which are very characteristic of rheumatoid arthritis. These are this is fibrous ankylosis and bony ankylosis. ठीक है, पहले on this slide just understand the term ankylosis and then we'll go talk about fibrous and bony. Ankylosis is actually immobility of the joint and the joint becomes stiff. Okay, so the term ankylosis means the joint becomes stiff and there is immobility of the joint. Person cannot move their joint. This is characteristic of rheumatoid arthritis, which is not very common in osteoarthritis. अब दो तरह का ankylosis होता है. Stiffness of the joint is secondary to two phenomena. One is the fibrosis, another one is the bony ankylosis. We keep on doing that. Okay, I again repeat, what rheumatoid arthritis is, it is a chronic systemic. Systemic का word क्यों use हुआ है? Because along with the joint, it is affecting other systems of the body as well, like skin, blood vessels, heart, lung, etc. Okay, so that is why it is called systemic. Osteoarthritis is a disease of joints. It's not going to affect the lung, it is not going to affect the heart, etc. Okay, so it is a chronic systemic inflammatory. Okay, that may affect many tissues and organs, but principally it attacks the joints. और joints में कैसी inflammation होती है? There is inflammation, but it is non-infective, non-suppurative, or inflammatory synovitis that progress to destruction of the articular cartilage finally, and ankylosis of the joints. So in the final stages of the joint, articular cartilage is gone, but unlike osteoarthritis, here the culprit is not the cartilage. Okay, so like many disorders, like especially many autoimmune disorders, the exact cause of rheumatoid arthritis is rheumatoid arthritis is unknown, but the genetic it is basically the combination of genetic predisposition and environmental factors like mycoplasma and Epstein-Barr virus. Okay, so basically the exact cause is unknown, but it is a combination of genetic factors and environmental. Genetic में क्या है? Different HLA types, और environmental में क्या है? Unknown viruses, but the suggestions are for Epstein-Barr virus and mycoplasma. There is some virus which is causing proliferation of the body immunity. Or in the end, what happens? That autoimmunity means the immune system of a person starts against its own body starts. The cells which are important are activation of the CD4 cells. I would like and I suggest you you did ये वही क्लास है जिसको मैंने न्यूप्लेजिया करवाया, तो प्लीज अगर हो सके तो जाके इन्फ्लेमेशन जो स्टार्ट बाय डॉक्टर नवीन फरीदी, just go and try to grasp the things from there, क्योंकि end of the year आपका पूरा एग्जाम होगा और अगर आप को चीजें याद नहीं होंगी तो you guys may end up in problem. Okay, so the autoimmunity activate होती है. Basically यहाँ पे किन cells का role है? It is the activation of CD4 cells. Okay, so the CD4 cells activate, and once these CD4 cells are going to be activated, they secrete cytokines like interferon gamma. And what does this interferon gamma, which is secreted by the CD4 cells, activate? It causes macrophage activation. And as a result of macrophage activation, different growth factors are released and process of phagocytosis starts, and there is a proliferation of synovial and fibroblastic proliferation. Okay, so सबसे पहले कि what happens in the body which causes the activation of these immune mediated cells. Okay, there is an antigen come in the body. This antigen could be a virus or it could be an unknown antigen. ठीक है, suggestion ये है कि virus होता है like EBV और mycoplasma, और बॉडी का इम्यून सिस्टम एक्टिवेट होता है अगेंस्ट दिस एंटीजन. ठीक है, फिर आपने इम्यूनिटी में जो चीज पढ़ी थी वो क्या थी कि एक्चुअली ये जो वायरस होता है इसका एक कंपोनेंट स्ट्रक्चरली और फंक्शनली समहाउ मिमिक करता है विद एनी ऑफ द जॉइंट नॉर्मल प्रोटीन्स और स्ट्रक्चर. So as a result, the immunity which is activated by CD4 cells. What happens? CD4 cells, CD4 positive T cells क्या करते हैं? CD4 positive is a type of the T cell, and what it in many ways activate immune system. It release cytokines like interferon gamma, and this, what does these cytokines do? They causes the activation of macrophage. Okay, so once the macrophages are activated, they release cytokine. Cytokine causes the proliferation of fibroblasts, chondrocytes, and synovial cells. For here, just for a minute, take a break, and if somebody want to reply in the chat box, they can reply in the chat box. ये मुझे बताएं कि जो normal joint होता है उसमें synovial membrane होती है, ठीक है, which we discussed in the last lecture कि normal joint is lined by the synovial membrane. तो what does actually this synovial membrane do? Synovial membrane का function क्या होता है? ठीक है, this synovial membrane, if you know, please write it in the chat box. I would like to see. नॉर्मल साइनोवियल, ताकि मुझे पता हो कि आपको हिस्टोलॉजी कितनी बेहतर रिकॉल हुई है. अगर नहीं भी हुई तो इट इज द राइट टाइम टू गो एंड रिविजिट इट. ठीक है, जो साइनोवियल मेम्ब्रेन होती है, साइनोवियल मेम्ब्रेन इज लाइंड बाय द टू टाइप ऑफ द सेल्स, टाइप A and type B cells. And what is the normal function of these type A and type B cell is the synovial cells are actually the macrophages. They are like macrophages, and the other cells are like those which secrete different proteases and have a role in inflammation. ये काम होता है ना synovial cells का. और synovial cells का क्या काम होता है? They release proteases, they causes the proliferation, they causes the repair of the cartilage. ठीक है, आप जाएंगे जाके synovial membrane के normal cells को देखेंगे. In the next lecture I'll ask कि क्या होते हैं. There are two type of the cells, वो activated macrophages होते हैं, one type of the synovial cells, and the other type of the synovial cells release proteases, and they actually controls inflammation. इसीलिए यहाँ पर what happens when the cytokines are released, there's macrophage activation. This macrophage activation will also happen in the joint, in the synovial membrane, where the cells which are lining the synovium are actually macrophages. So there's activation of cells at that point which release cytokines. Cytokines causes the activation of fibroblasts, chondrocytes, synovial cells. And as a result of all this process, what is going to happen? There's release of enzymes, prostaglandin, and they causes the proliferation of synovial lining as a part of reactive process. And so this is called Pannes formation. मैं आगे भी discuss करूँगी. Okay, this is one part of how the T cells activate the release cytokine and causes macrophage activation. What happens simultaneously? They causes the B cell activation. Okay, the antibodies which are produced in the body are actually not produced by the T cells; they are produced by the B cells. Okay, so this B cell activation causes the formation of antibodies, and they form complexes in the joint and causes joint injury. So actually, the joint injury which happens in rheumatoid arthritis is actually combination of two. One part is activation of CD4 positive T cells which have been activated secondary to exposure to an unknown antigen, which studies suggest could be a virus or could be a virus or could be a structure in the joint which actually mimics with the structure of the virus. So once these T cells are activated, they cause the release of cytokine, which do this all and causes finally the inflammation. And there is another pathway through which the joint is damaged, that is by the production of antibodies. And why these antibodies are produced? Because simultaneously B cells are activated. And keep it in mind that the antibodies are not secreted by the T cells, they are secreted by the B cells. So there's B cell activation and formation of the autoantibodies. अब दो autoantibodies you are going to remember. The one is the RA antibody जिसको हम RA factor कहते हैं. ठीक है, ये this is diagnostic of rheumatoid arthritis. Another antibody is anti-CCP antibody, which is anti-citrulline peptides, antibodies against citrullinated peptides. What are these citrullinated peptides? In which arginine is replaced by the citrulline. So it is anti-CCP, anti-citrullinated peptide, antibodies against anti-citrullinated peptides. So two tests which are diagnostic of rheumatoid arthritis RA factor or RA antibody, which are actually the IgM or IgG against the Fc fragment of IgG, and the other is the anti-CCP. So this part, which is diagnostic of the rheumatoid arthritis, comes from here by the B cell activation. So in the same times, there is another pathway which is called, when there is recruitment of leukocytes. Okay. Morphology, two or things in osteoarthritis. I have explained okay, what are the things which are important in the morphology part. Again, there are few things which you need to remember in the rheumatology part. One is the gross or macroscopic. What happens grossly? The joints becomes edematous, thickened, hyperplastic, in the form of bulbous fronts. Recall from what you learned in the chapter of inflammation. जब भी inflammation होती थी, what happens at that site? There is a blast of the cells. Lot of cells comes to that area. The endocapillaries become porous, so there is lot of fluid and all that. What all that make is it causes lot of fluid accumulation over there. तो वो जगह क्या होती थी? Swell हो जाती. The same thing is going to happen in rheumatoid arthritis. The joints become edematous. Why? Because acute inflammation is going on. The joints become edematous, they become thickened and hyperplastic. Why hyperplastic? Because over here we have seen that the cytokines are released, there is macrophage activation, and they are causing the proliferation of all these cells, which are fibroblasts, chondrocytes, and synovial cells. So when there is proliferation of all these cells, there is actually hyperplasia. So it becomes hyperplastic. The bulbous forms, I tell you. And what happens in the late stages? There is spannous formation. What is this spannous formation? I'll discuss this is I'll discuss in the next. There is cartilage destruction. Why there is cartilage destruction? Because when a lot of inflammation is happening at any place and it is not repaired, it is not stopped at the particular point in time, it starts causing the destruction of normal structures. That is why there is cartilage destruction followed by fibrous ankylosis and bony ankylosis. मैंने आपको बताया कि ये दो characteristics हैं of rheumatoid arthritis which does not happen in osteoarthritis. ये याद रखिए. Ankylosis का मतलब होता है the joint has become stiff, the joint has become immobilized. Fibrous का मतलब है बहुत आसान है, inflammation जो normal आपने inflammation पढ़ी थी, if chronic inflammation does not repair, what is going to happen? अगर chronic inflammation stop नहीं होती या chronic inflammation की fate क्या होती है? एक तो ये होता है complete recovery हो जाए or it is replaced by the normal tissue. What is the other fate of the chronic inflammation? That if chronic inflammation the normal repair does not happen, what is going to occur? That the normal tissue is replaced by, normal parenchyma is replaced by the fibrous tissue. Body में हर जगह अगर liver damage हुआ है, liver cirrhosis क्या होता है कि normal liver parenchyma is replaced by the fibrous tissue. ठीक है. इसी तरह लंग में क्या होता है कि अगर लंग डैमेज हो गया तो वहां पे फाइब्रोस और इट इज नॉट रिप्लेस्ड बाय द नॉर्मल लंग टिश्यू, रिपेयर नहीं होता तो इट इज रिप्लेस्ड बाय द फाइब्रस टिश्यू. इसी तरह बॉडी में लाइक एनी अदर पार्ट ऑफ द बॉडी, जॉइंट्स में अगर इन्फ्लेमेशन होगी एंड इट इज नॉट रिपेयर्ड इन टाइम, इन्फ्लेमेटरी सारा सेल्स वहां से खत्म नहीं होंगे तो इट विल एंड अप इन फाइब्रस. तो इसको कहते हैं फाइब्रस एंकाइलोसिस. मतलब जॉइंट इमोबाइल हो गया है बिकॉज ऑफ फाइब्रोसिस. And what is bony ankylosis? That fibrous tissue transformed into haphazard bone, वो calcify हो जाता है, and that calcification is called bony ankylosis. वहाँ पर bone बन जाती है, but that bone is not the normal bone. So that is bony ankylosis. ये दो terms are characteristic of rheumatoid arthritis. अगर मैंने आपको एक scenario दिया, मैंने कहा joint fibrous ankylosis हो गया, bony ankylosis हो गया, the diagnosis is rheumatoid arthritis. इसकी याद रखिए. इसी तरह पैनिस फॉर्मेशन इन आपको एक्सप्लेन करके अंडरस्टैंड के इस तरह समझ नहीं आएगा, लेकिन पैनिस फॉर्मेशन इज अगेन कैरेक्टरिस्टिक ऑफ रूमेटॉइड आर्थराइटिस. हिस्टोलॉजी में इफ आई लुक एट द जॉइंट अंडर द माइक्रोस्कोप, व्हाट आई कैन सी साइनोवियल प्रोलिफरेशन. आई टोल्ड यू द रीजन एज वेल. देयर आर लिम्फोइड फॉलिकल्स. लिम्फोइड फॉलिकल्स क्या होते हैं? अगर आप नॉर्मल लिम्फ नोड का स्ट्रक्चर रिकॉल करें तो उसमें lymphoid follicles होते हैं. There is lot of inflammation is going on, lot of the antibodies are produced, that is why there are lymphoid cells are there. There's surface fibrin and neutrophils because a lot of acute inflammation is there in the initial stages, and finally it results in bone erosion, cysts, cartilage destruction, etc. Okay. Now what happens? Pehle normal joint dekhte hain. What happens in the normal joint? This is a normal knee joint, femur, tibia. What is this? This is the capsule of the cartilage, and what you can see over here that this is the synovial membrane. Okay. This bluish part is the cartilage, and then this flattened area is the meniscus. This is the normal healthy joint. Normal healthy joint, this is capsule, and what I again and again emphasizing, this is synovium. Now what happens when the rheumatoid arthritis occurs? You should go and read the normal functions of the synovial cells. Synovial cells का क्या function होता है? They are activated macrophages. They have the ability to secrete proteases and to repair the cartilage and proliferation of the cell. They actually control all these mechanisms. And this area is avascular, so basically the nutrition supply reaches over here through the process of diffusions. Now what happened is that in cases of rheumatoid arthritis, this is capsule, it is all okay. But what has happened here, where there is lot of red color. There is inflammation going over here, going on over here. Okay? Swollen inflamed synovial membrane. The synovial membrane की उसने macrophages secrete किए. There is fibroblastic proliferation. The area becomes edematous, and what is going to happen is that as a result, when there is lot of fluid over here, and there is lot of the inflammatory cells, this area becomes swollen. If you compare it with this is very nice, but over here you can see enlargement. Why this enlargement is there? This enlargement is there because there are lot of inflammatory cells present in this area, secondary to activation of inflammation. And what we can see, this white area is the cartilage. So here in the final stages, the cartilage is gone. Okay, you can see the cracks in the cartilage. Over here, the cartilage, their bony erosions are there. Because cartilage, the pushing effect of the cartilage is going to occur. What is going to happen next is the bone erosion. Okay, or small fractures in the bone. The same happens in osteoarthritis. But in the osteoarthritis, the problem begins with the cartilage. Here, the cartilage is affected in the end. ठीक है, हम ये तो नहीं कह सकते rheumatoid arthritis को कि ऑस्टियो नहीं है तो यहाँ cartilage spare है. Definitely जहाँ inflammation होगी वहाँ normal structures destroy होंगे. And as a result, you can see that finally the joint space is gone. So this figure is from Robbins. This is the schematic representation of rheumatoid arthritis in the joint. The red material that is growing over the articular cartilage. Okay, here this is the bone. This is the bone. This is the capsule of the joint, and over here is this is the synovial membrane. This is the synovial membrane. Now what has happened? There is collection of lot of blood, lot of fluid over here. Okay, this red area is representing the collection of fluid. As a result, the joint has become swollen, and what we can see is that destroying it is, and then finally, when the inflammation is there, lot of granulation tissue formation occurs. And this granulation tissue formation and synovial proliferation result in the form of pannus formation. What is actually pannus is? It is the combination of granulation tissue, which is actually a precursor to scar tissue. And what happens here is that as the inflammation is not healing, so it is replacing by the fibrous tissue, and it is called fibrous ankylosis. ठीक है, ये fibrous ankylosis हो गया. जब ये fibrous ankylosis calcify हो जाएगा तो it is called bony ankylosis. And what you can see over here, यहाँ पे joint space खत्म हो गई क्योंकि यहाँ पे bone हो गई है, and it will make the joint stiff and immobile. Again repeat क्या होता है, यहाँ से synovial membrane involve होती है because के normal वहाँ पे if they are macrophages, it causes activation, inflammation. When there is lot of inflammation, lot of granulation tissues को morphologically कहते हैं pannus formation. Pannus formation is characteristic of rheumatoid arthritis. What is going to happen next is there is destruction of the cartilage. As you can see, cartilage is gone from this area. And once this inflammation becomes autonomous, it keep on going there, and there is no process of repair. What is going to happen? This is replaced by fibrous tissue. And when the fibrous tissue come in the joint space, they become immobile. Okay. So rheumatoid arthritis, the joint disruption is characteristic of rheumatoid arthritis. This is normal. Okay. So this is bone. This is bone. This blue is the cartilage. मैंने आपको बताया था cartilage को usually कोशिश करते हैं white और blue से show करें because it has a normally it has glistening whitish blue appearance. Okay, so this is cartilage. This is nice synovial membrane. Normally it is like this, and this is the joint capsule. ऐसा ही होता है ना, joint capsule है और ये साइनोवियल मेम्ब्रेन है, ठीक है। और यहाँ पे जॉइंट में क्या होता है, साइनोवियल फ्लूइड होता है। बेसिकली वो साइनोवियल फ्लूइड कहाँ से आता है, बाय द प्रोसेस ऑफ डिफ्यूजन, और उसका फंक्शन क्या होता है, टू प्रोवाइड न्यूट्रिशन एंड टू मेंटेन द नॉर्मल कार्टिलेज मेटाबॉलिज्म, normal cartilage integrity. Now what happens here is the synovial membrane, this is the synovial membrane, it becomes activated. The macrophages in the synovial membrane activated by the T lymphocytes, they secrete different cytokines. As a result, there is a lot of fluid coming over here. So there are more of the fibroblasts, plasmacell, endothelial cells, and there is as a result, this area becomes swollen. And in the synovial fluid, there will be more neutrophils. ठीक है, initial stages में there is recruitment of the acute inflammatory cells as well. And as a result of this inflammation, what is going to happen? You can see the cartilage, which was nice with the smooth contours on the normal side. It has lessened. It has thinned out, and it has become irregular. ठीक है, यहाँ पे cartilage कम हो गई. तो in the final stages of rheumatoid arthritis, also the cartilage is gone. And once the cartilage cover of the joint is gone, what is going to happen next? Cartilage के बाद inflammation रुक तो नहीं जाएगी. Inflammation will affect the area which is beyond that. Cartilage के नीचे, cartilage के beyond, cartilage which is under the cartilage is the bone. So secondarily, it will lead to the erosions of the bone. And once this inflammation does not subside, what is going to happen? It will lead to fibrosis. Fibrosis ऑस्टियोआर्थराइटिस में इसलिए नहीं हो रहा था क्योंकि ऑस्टियोआर्थराइटिस में there were not lot of inflammatory cells. Inflammation was not the culprit, so that is why the fibrosis was not happening, the ankylosis was not happening usually in osteoarthritis. It is characteristic of rheumatoid arthritis. Why? Because rheumatoid arthritis is chronic inflammatory autoimmune mediated disease. Okay, again this figure is from Robbins. You can have it in exam. So if any problem, I always try to point out which are the figures which are taken from Robbins. Okay, this is from Robbins. So this is schematic representation. What you can see, again, it is a repetition of same. I used to explain the same thing on different figures because to some students, one figure clicks other to the other, but in the end, all of the class will understand the basic concept. Okay, I want your feedback in the chat box in the end. This is the normal synovial membrane, but what has happened here? You can see the synovial membrane is thickened, जिसको हम and it has lot of granulation tissue. इसलिए हम यहाँ क्या कहते हैं? क्या हो जाएगा? Pannus formation. Pannus is the things which are hanging like this in the joint space because of inflammation. This is pannus formation. Pannus formation is diagnostic of rheumatoid arthritis. This is photomicrograph which I see as a histopathologist under the microscope, and this is characteristic of rheumatoid arthritis. Okay. So what has happened here? The synovial membrane is thickened. Okay, compare it to this normal synovial membrane. There are a lot of the inflammatory cells, including macrophages, which is causing release of cytokines, etc., and causing activation of the fibroblasts. The plasma cells are there. Plasma cells कहाँ से आए? Plasma cells have been derived from the B cells, which actually produces antibodies. कौन सी दो antibodies diagnostic होती हैं of rheumatoid arthritis? It is RA factor and anti-CCP antibodies. ये याद रखना है, ये question is frequently asked. Anti-CCP, और ये याद रखिए कि CCP का abbreviation पूछा जाता है exam में. Anti-citrulated peptides. Okay, because antibodies are produced against this component in which the normal arginine is replaced by citrulline. This is written in the Robbins, और ये बता रही है, पूछते हैं. और ये anti-CCP का abbreviation पूछा जाता है कि what is the full name of anti-CCP. Okay, so this is histological picture, and this is another view which is at a higher magnification, and it is showing presence of lot of the inflammatory cells, B cells, lymphocytes. ठीक है, इसमें अगर आपको लो पार पे ये फिगर देखे और सिनेरियो देखे, बिल्कुल रूमेटॉइड की डायग्नोसिस पूछी जा सकती है. ठीक है, लेकिन डेफिनेटली सिनेरियो होगा. और याद रखिए कौन से दो टेस्ट डायग्नोस्टिक होते हैं? RA, although it is present in 80% of the cases, and anti-CCP antibodies. ये याद रखना है, and also you should know the full name of anti-CCP. This is high power view of the Panus formation, areas of Panus formation. बार बार फिगर दिखाने का मतलब है Panus formation याद रखें. This is diagnosed. ये सारी joint की surface है, ठीक है. This is photomicrograph HED, and these bulbous areas are called Panus. They are comprised of inflammatory cells in the initial stages of granulation tissue, later replaced by the lymphocytes, plasma cells, and B cells, which are responsible for the production of antibodies. Okay, so this is the normal joint, and what has happened over here, this is osteoarthritis. Okay, what you can see over here, that the joint space is finally narrowed and cartilage is going, but this is osteoarthritis. But you can see that the joint is not that much solid, but in rheumatoid arthritis, the joint, there is a lot of swelling in the joint. Why there is a lot of swelling in the joint? Because जहाँ भी inflammation होती है, acute followed by chronic, there is lot of edema, there is lot of fluid which actually causing swelling of that area. जब हम neoplasia किया था, तो usually the term, initially the tumor was used, and it is used for swelling which is secondary to inflammation. Okay, so this is rheumatoid arthritis. We cannot see a lot of inflammation over here, but finally the bones touch each other, there is erosion of the bones. But you can see that in the initial stages, the cartilage is intact in rheumatoid arthritis. And basically, it is the inflammation which is causing the swelling joint, etc. And finally, in the late stages, the cartilage and bone are affected. So, other systemic manifestation of the rheumatoid disease are skin. In the skin, there are rheumatoid nodules. The rheumatoid nodules can also be appreciated in lungs, spleen, pericardium, heart valves, etc. In blood vessel, in rheumatoid arthritis, there is vasculitis, which is called vasoaneurysm, or usually in the digital arteries. This is the photomicrograph of rheumatoid arthritis. What we can see is that there is this is necrotic area, and this is the histiocytic or macrophage, which is forming the edge of the lesion. And this can be found in skin, which is called rheumatoid nodule, even in lungs and other organs as well, because it is a systemic disease. This figure is from Robbins. This is a subcutaneous rheumatoid nodule with an area of necrosis. This is necrosis. Necrosis क्या है? Necrosis is a form of cell death where you can't see the nuclei. जब भी ये blue area नजर आते हैं, इसका मतलब होता है कि ये photomicrograph और HNE आप देखते हैं, इसका मतलब है nuclei viable है. When these nuclei are gone, it means a form of cell death has occurred. This is called necrosis, and this is proliferating. These are the histiocytes. So clinical presentation is extremely variable, begins slowly and insidiously. Patients will present with the malaise, fatigue, and generalized musculoskeletal pain. Clinically, there is symmetrical involvement of the small joints before the larger ones, hands and feet, followed by wrist, ankle, elbows, and knee. If you remember, the wrist, ankle, and elbows are usually spared, not knee, but these are usually spared in osteoarthritis. The joints are swollen, warm, painful. ठीक है, जहाँ पे भी इन्फ्लेमेशन होती है, आज मेरे हाथ पर चोट लग जाए और तो यहाँ पे क्या अगर मैं उसको फील करूंगी तो वो कैसा होगा? वो सोलन होगा जहाँ एक्यूट इन्फ्लेमेशन होगी. एक्यूट इन्फ्लेमेशन का जनरल रूल है, it will be there with every system. It becomes swollen, warm, painful, and particularly stiff on arising and following inactivity. The radiological hallmarks are joint effusions and juxtaarticular osteopenia with erosions and narrowing of the joint space and with loss of articular cartilage. So this is the rheumatoid arthritis. This is the presence of 4 of the following criteria are required for the diagnosis of rheumatoid arthritis. It is morning stiffness, arthritis in 3 or more joint areas, arthritis of hand, symmetrical arthritis, rheumatoid nodules, serum RA factor, and typical radiological findings. In the lab investigations, it is the RA factor, ANA, and anti-CCP. I should have mentioned over here, but missed. Analysis of synovial fluid. Synovial fluid analysis में क्या मिलेगा? Next class में आप मुझे बताएंगे when we'll be doing crystal-induced arthritis. Sorry, I'm running out of time. Treatment are physical physiotherapy, NSAIDs, and disease-modifying drugs. These will be discussed in detail. So what has happened in the acute cases? The joints have become swollen and red. followed by, this is the chronic stage in which you can see that the fingers are not straight. They have become, and believe me, they have become stiff. ठीक है, ये finger इस direction में stiff हो गई है क्योंकि fibrosis हो गया है, इस direction में होगी. The characteristic abnormalities of rheumatoid arthritis are botanier deformity and swan neck deformity. इसमें होता क्या है botanier deformity में, the middle joint of the small finger become immobile in a flex form, and this is in this the distal joint in a hyperextended forms. तो ये क्या हो जाता है कि ये यूं हो जाता है, ये joint भी stiff हो जाएगा, लेकिन ये joint भी stiff हो जाएगा. It is in the upward direction because of the damage to the tendons, etc. So this is called botanier deformity, and this is the swan neck deformity. What has happened that this is in the hyperextended form. It has, this middle joint has become this, and this is hyperflexion in the distal joint, and they have become immobile in the end stages, secondary to fibrous ankylosis and bony ankylosis. The joints become like this. The joint deformity is characteristic of rheumatoid arthritis, and this botanier deformity and swan neck deformity are characteristics of rheumatoid arthritis. So the natural course of the rheumatoid arthritis is, at presentation, the hands are like this, and then the joints start undergoing deformity. What is going to happen? Some fingers are straightened like this, and some will be hyperflexed like this. And finally, what happens that in the chronic cases, if the disease keeps on progressing and does not respond to the drugs, the hands could be like this. So there's progressive damage leading to the joint deformity and disability. The extra-articular manifestations are nodules in the lung, eyes, vasculitis, etc. Life expectancy definitely can be diminished if the things go bad in vessels, etc. So यहाँ पे ये क्या चीज है? Skin nodules. These are the skin nodules. Over here, this is the patient. There's a skin. ये skin है. Skin के नीचे एक nodule है. If I do biopsy of this nodule and see it under the microscope, they will show appearance like I have shown in over there, that there is necrosis with histiocytic collection, which is called rheumatoid nodule. Okay, so the common sites of rheumatoid nodules are these surfaces. So this is the last slide, which is showing the differences between osteoarthritis and rheumatoid arthritis. Do go and do it.